Hi, I'm Elena Nunley, Program Coordinator for New Life Now Weight Loss at Baptist Hospitals in Southeast Texas. We're here visiting with Dr. Alex Ordonez regarding the importance of when a patient is ready to discharge home and what their instructions will be. We do know that preparation for this day is very important and must be taken very seriously before you come in for your procedure on those days. Please feel free to contact our office if you have any questions, but we want to hear some of those tips from Dr. Ordonez. Afternoon.
Hello. What we make sure is that for the last time I see my patients in clinic, we always make sure that they have everything ready. We give them a prescription for pain medication. We make sure that they already have the pain medication, so that's not a problem. That's not a problem when they go home. Sometimes nausea can be a problem. It's not a common thing, but it's also important that if that's the case, they also have a prescription for nausea. The day of surgery, I kind of go over the day after surgery, I should say. I go over with the patients about wound care restrictions, basically general instructions that they need to know in terms of what to do after surgery. I always remind them that they have to make an appointment soon with the nutritionist for follow-up as well as with their PCP. It's very common that shortly after surgery they're going to see a change in their blood pressure and their blood sugars, and a good number of patients need a change in the dosages of the medications. So that's also important to remind them that they need to think about getting an appointment with those providers.
Excellent. You see, better preparing yourself means better success. We want you to be sure and have the appropriate foods already on hand before coming in for your surgery. So be sure to look at your foods list in the booklet provided at your first consultation with Dr. Ordonez. Keep all of those appointment numbers and be sure that you have someone at home with you the day that you go home. You will need a little bit of assistance. Those medications are there for you to take when needed. We want you to have them ready to go on hand so there would not be any delay in your care. Thanks, and stay tuned for more tips.